Health and social care policy is based on our brand new Belfast campus. The course covers issues such as how the health service is structured and funded, how social care is structured and funded, and what are the current issues facing health and social care in today's society.
I chose health and social care policy at Ulster because I had a real interest in the health-related policies in Northern Ireland, and in particular anything to do with sort of female health, sexual education and the abortion laws within Northern Ireland and just how they vary with the rest of the UK. I looked up the modules and a lot of them really correlated with this. We're able to pick a gender module which really will look at that female health and again the inequalities between male and female health within Northern Ireland and the rest of the UK.
I chose health and social care policy because I've always loved to help people, and I believe studying health and social care policy will help me to achieve that.
I wanted to work with people in a kind of supportive role. Whenever I started the course, I was a mature student. I had worked for years in hospitality and offices, and I just realised that I wanted to do something kind of more meaningful. So I really enjoyed learning about the history of the NHS, what was in place before the NHS came about, how it came to be, and then kind of contemporary issues facing the NHS today. Favourite modules on the course would have been the disability module, the gender and social policy module, and the module on migration, race and ethnicity.
So all second year students go on a 6-week full-time placement to an organisation that they choose. The strength of the placement opportunity is that the student chooses it based on their future career aspirations, and that might be an organisation within the public sector or within the NGO sector. So for students who are interested in policy and research, they have opportunities to work for the Northern Ireland Children's Commissioner or the Equality Commission or a research unit of a charity. Recent examples of that have been Training and Employment Officer for MENCAP, Policy Officer for the Big Lottery Scheme, and we've also had a number of graduates who have had direct entry into the Civil Service Graduate Programme.
I started working in my current job, which is an employment officer for Orchardville. So in my job, I support adults with learning disabilities and autism to find and maintain employment. The year-long placement I did with the PSNI, so I ended up working with the Public Protection branch on a large adult safeguarding investigation. It was a great experience for me and something I've been able to use in my career since then.
The support at Ulster has been great so far. The lecturers are always very quick to reply. Their emails are always open and they really make that known.
The teaching staff really couldn't do enough to kind of help and support you. And you could tell that they really wanted you to do your best and were there to kind of help you achieve as much as you could.
My advice to anyone wanting to pick health and social care policy at Ulster, before coming, definitely read through the modules and see if it's something that you want to take part in, but also do not be scared to come if you have been out of school for a while or you have a different academic background. We have a real variation within the class, so don't be worried about that at all.
My advice for anyone studying health and social care policy is for them to go for it. There are a lot of skills to be gained, lots of knowledge to be gained from it, and there are a lot of support and also lots of academic resources.
I would say if you care about kind of social issues, then definitely apply. If you want a career in healthcare or social care, definitely apply because it will open a lot of doors. Be prepared to read a lot and, to have discussions about things and to have your views challenged, because not everybody has the same views on the course, but it's a great way and a great place to kind of discuss, big social issues in a supportive environment.
If I had to describe health and social care policy in 3 words, it would be thought-provoking, challenging, and sometimes a bit controversial.
If I could describe the course in 3 words, I would say challenging, it is informative and interesting.